Hey everyone, welcome back to the channel. Today, we're talking about a fruit that's in almost every kitchen, every lunchbox, every smoothie, the banana. We all know them, we all love them. They're packed with potassium, fiber, and essential vitamins, making them a go-to healthy snack. I mean, they're nature's original energy bar, right? But here's something you might not have considered. Can there be too much of a good thing? While bananas are celebrated for their health benefits, and rightly so, they can also come with some surprising side effects that you absolutely need to be aware of. This isn't about fear-mongering or telling you to throw out all your bananas. It's about being informed and making the best choices for your individual health. In this video, I'm going to break down 7 potential side effects of eating bananas that you probably haven't heard of. We'll go through the science, look at the evidence, and figure out what it all means for you and your diet. Knowledge is power, especially when it comes to what we put into our bodies. For some people, especially those with certain pre-existing health conditions, these side effects can be more pronounced. This means that while most of us can enjoy bananas without a second thought, some individuals might need to limit their intake or even avoid them altogether. So, if you've ever wondered if your favorite yellow fruit could be causing you issues, or you're just curious about the full picture of nutrition, stick around. Let's peel back the layers and get into the science. Let's start with something that can be quite serious for a small group of people: allergic reactions. It might sound unusual, but banana allergies are real. For most, an allergy might manifest as mild symptoms. You might eat a banana and notice some itching or tingling in your mouth and throat, a condition known as oral allergy syndrome. This often happens because the proteins in bananas are similar to proteins found in certain pollens, like ragweed. So if you have hay fever, you might be more susceptible to this cross-reactivity. It's your immune system getting a little confused, essentially. But for others, the reaction can be much more severe. We're talking about hives, swelling of the lips, face, and tongue, or even gastrointestinal distress, like cramping and vomiting. In the most extreme, albeit rare cases, a banana allergy can trigger anaphylaxis. This is a life-threatening, whole-body allergic reaction that requires immediate medical attention. It's crucial to recognize these signs. If you ever experience difficulty breathing, a rapid drop in blood pressure, or feel faint after eating a banana, you need to seek emergency help right away. It highlights how a seemingly harmless food for 99% of people can be a serious danger for that 1%. This is a big one because potassium is the nutrient bananas are most famous for. And yes, potassium is vital. It's an electrolyte that helps your nerves function, muscles contract, and your heartbeat stay regular. Most of us don't get enough potassium, so bananas are a great way to boost our intake. However, it is possible to get too much, leading to a condition called hyperkalemia, which means high potassium in the blood. For a healthy person with functioning kidneys, you would have to eat an absurd number of bananas, we're talking like 40 or 50 in a single day, to reach dangerous potassium levels. Your kidneys are incredible filters and would just excrete the excess. The real concern here is for people with compromised kidney function or chronic kidney disease. When your kidneys aren't working at 100%, they can't effectively remove excess potassium from your blood. In these cases, even eating a few bananas regularly could cause potassium to build up to toxic levels. This is serious stuff. Symptoms of hyperkalemia can range from muscle weakness and numbness to nausea, and most critically, an irregular heartbeat or even cardiac arrest. This is why it's so important for patients with kidney issues to work closely with their doctor or a registered dietitian to manage their potassium intake very carefully. Let's talk about what happens in your gut. Bananas are often recommended for digestive health. They contain pectin, a type of soluble fiber that can help normalize bowel function, and they're a key component of the brat diet for diarrhea. But there's a flip side. The impact of bananas on your digestion can really depend on their ripeness. Unripe, green bananas are high in resistant starch. This type of starch acts like fiber, and can be great for your gut bacteria. But for some people, it's difficult to digest. This can lead to significant gas and bloating as the bacteria in your large intestine ferment the starch. On the other hand, while ripe bananas can help with diarrhea, eating too many of them, especially if you're not drinking enough water, can potentially lead to constipation. This is because the fiber in bananas absorbs water in your intestines, which helps to form stool. But if there isn't enough water to go around, it can slow things down and make stools hard and difficult to pass. So, the very fruit that can help with one digestive issue can cause the opposite problem if the balance is off. It's all about moderation and listening to how your own body responds. Alright, so this is a side effect that many people find really surprising. If you're someone who suffers from, those debilitating migraines, you're probably very careful about potential food triggers like aged cheese, processed meats, or red wine. But you might want to add bananas to your list of suspects. The culprit here is a substance called tyramine. Tyramine is an amino acid that helps regulate blood pressure, and it's formed from the breakdown of the amino acid tyrosine. You can find it in a variety of foods, and bananas, particularly when they are very ripe or overripe, have higher concentrations of it. For individuals who are sensitive to tyramine, consuming it can trigger a hypertensive reaction, causing blood vessels in the brain to constrict and then rapidly expand, which is a mechanism known to initiate a migraine attack. The banana peel, by the way, contains about 10 times more tyramine than the pulp. So while most of us aren't eating the peel, it's something to be aware of if you're, say, blending the whole fruit. If you're a migraine sufferer and you notice a pattern of headaches after eating bananas, it might be worth eliminating them from your diet for a while to see if your symptoms improve. We think of candy, soda, and cake when we talk about sugar and cavities, but we can't forget about the natural sugars found in fruit. Bananas are sweet for a reason. They contain a significant amount of sugar, primarily in the form of sucrose, fructose, and glucose. A medium-sized banana can have around 14 grams of sugar. When you eat a banana, the bacteria that live in your mouth feed on these sugars. As a byproduct of their feast, these bacteria produce acids that can eat away at your tooth enamel, the hard, protective outer layer of your teeth. This process is what leads to dental caries, or cavities. Now, am I saying bananas are as bad as a lollipop? Of course not. Bananas also contain fiber and important minerals. But the sugar content is real, and because of their soft, sticky texture, bits of banana can easily get lodged between your teeth, giving those bacteria a prolonged source of fuel. This doesn't mean you should stop eating bananas. It just reinforces the importance of good dental hygiene. Make sure you're brushing your teeth twice a day, flossing regularly, and maybe having a sip of water after your snack to help rinse away some of those sugars. Ever feel a little drowsy after eating a banana? You're not imagining it. Bananas are nature's little sleeping aids for a couple of key reasons. First, they contain tryptophan. This is an amino acid that the body can't produce on its own. You've probably heard about it in relation to Thanksgiving turkey, making you feel tired. In the brain, tryptophan is a precursor to serotonin, a neurotransmitter that promotes relaxation and has a calming effect. Serotonin, in turn, can be converted into melatonin, the body's primary sleep hormone, which regulates your sleep-wake cycle. On top of the tryptophan, bananas are also an excellent source of magnesium. A medium banana provides about 8% of your daily magnesium needs. Magnesium is known as the relaxation mineral for good reason. It helps to calm the nervous system by binding to GABA, or gamma-aminobutyric acid, receptors, which are inhibitory neurotransmitters that help to quiet down nerve activity. So, the combination of tryptophan and magnesium can definitely have a sedating effect on some people. It's great if you're having a banana as an evening snack to wind down, but maybe not the best choice if you need to be sharp and alert for a big afternoon meeting. This last point is incredibly important and something everyone on medication needs to consider with their diet. We already discussed the high potassium content in bananas. This same mineral can cause potentially dangerous interactions with certain types of medications. The most notable examples are ACE inhibitors, like lisinopril or enalapril, and angiotensin II receptor blockers, or ARBs, like losartan. These are common blood pressure medications that work, in part, by increasing potassium levels in the body. If you're taking one of these drugs, and also consuming a lot of high potassium foods like bananas, your potassium levels can rise too high, leading to that hyperkalemia we talked about earlier. Another class of drugs to be aware of are beta blockers, also often prescribed for heart conditions and high blood pressure. They can also increase potassium levels in the blood. Even certain diuretics, sometimes called water pills, can be potassium-sparing, meaning they help your body retain potassium. The key takeaway here is not that you must avoid bananas if you're on these medications. Rather, it's a call to have a conversation with your doctor or pharmacist. They need to know about your diet so they can advise you on a safe level of potassium intake and monitor you appropriately. Never make changes to your diet or medication without professional medical advice. So there you have it. 7 surprising side effects of one of the world's most popular fruits. As we've seen, the story is more complex than just bananas are good for you. From allergies and digestive issues to potential medication interactions, it's clear that context is everything. For the vast majority of us, enjoying a banana every now and then is a perfectly healthy, beneficial part of a balanced diet. The key, as with so many things in health and nutrition, is moderation, and most importantly, listening to your own body. What works wonders for one person might cause issues for another. Understanding these nuances is the first step toward taking control of your health. It's not about eliminating foods you love, but about understanding them fully so you can make informed decisions. If you're experiencing digestive problems, fatigue, or other unexplained symptoms, it's always worth looking at your diet as a potential factor. Building a foundation of knowledge is crucial for long-term wellness. If you want to dive deeper into this and learn more about optimizing your diet for better digestion and overall vitality, I've put together a comprehensive resource for you. I invite you to check out my Natural Health Guide, which you can find by clicking the link in the description below. It's packed with evidence-based tips and practical advice to help you feel your absolute best. Thank you so much for watching and for being a proactive member of this health-conscious community. If you found this video helpful, please hit that like button, subscribe for more content, and share your thoughts or experiences with bananas in the comments below. Stay safe, stay curious, and I'll see you in the next video.